I feel like this day and age, nurses have been given so much attention, but at the same time, we need more support. So I'm here for y'all. All right, so we're back, or I guess I'm back. Okay, let's talk about my experience as a new grad. So I started out in 2018, and oh my gosh, when I started, I found out that I was the only new grad in float pool. Everyone that would ask me like, oh, what area are you going to? I'm like, oh, I'm going to med surg float pool. They're like, as a new grad? Like, no one does that. They don't do that. Why are you starting a float pool? I'm like, I don't know. They offered me the position, I took it. So people were like, are you scared? I was like, no, I don't know what to expect. And this happened all throughout my whole orientation. I was on orientation for 4 months, which was, I think, a month extra than the regular residents that were on dedicated floors. And the way my orientation was set up, my educator was very, very involved. She is really the reason why I was even hired. So I do give her props for that. Like, I really appreciate that. Not that she knew it was me or that it was personal, but the fact that she put a neck out, in a sense, for this new grad to get into this role, to try to bring in new grads into the float pool, I thought that was dope. But my educator she is like, I don't even know how to explain her. She is a very strong personality, and she is like a boss. Like, that's what I'm gonna say. She's a go-getter. She's a boss. Like, she's about her business. She had a whole bunch of side stuff that she was doing on top of being a nurse. And so she was basically trying to recreate herself in me. Now, she's very like high-strung on it, very talkative, talks fast. And I talk fast, but she's like very, when she steps in the room, like, you know she's there and she's gonna take over. I'm not really like that. Like, I like to observe first, and then I kind of like open up as I go. So that was an interesting dynamic of her, but I just took it as a learning point, someone to learn from. But the good thing about that was she pushed me very hard to make sure that I basically represented her well, and I felt the pressure. I felt like this pressure was good for me. So I started on this one floor. It was the GI surgery floor, and I was on that floor for 6 weeks with one of their nurses as my preceptor, which was cool. They started me on this floor because it's really the most difficult, most involved floor in the whole hospital in regards to med-surg. Like, they're getting the colorectal surgery, you know, you're gonna have a ostomy, you're gonna have JP drains, you're gonna have NG tubes. They also did pancreatic cancer, like pancreatic surgery. So there was a lot of Whipple patients. And so these were like, it was the higher acuity of all of med-surg. So they started me on that floor. She said that if you can figure this out on this floor, everything else will just be an addition. So this is the floor I want you to start on. That was cool. The only thing that sucked was that my preceptor, she was nice, she was awesome, she's very smart, but she just kind of coddled me a little bit and was a little bit too hands-on in the beginning. So I only had 6 weeks with her, and I only got up to caring for 2 patients on my own in 6 weeks. So after the 6 weeks was done, I was doing pretty good from her report, like, but at the same time, she was always watching me over my back. She was always doing stuff a little bit before me, like, instead of letting me figure out, because really a lot of the stuff is muscle memory and just putting pieces together. So like when it comes to charting, when it comes to regular stuff like hanging medications or giving PO medications, or even like dressing changes, like these are things that are very basic and you need to learn the muscle memory of it. The hard part when it comes to nursing is time management and being able to know who to see first, like who's most important out of all your patients. And in this hospital, we would get up to 5 and 6 patients, mostly 5, sometimes 4. On a bad day, it would be 6. So time management was everything. I don't have good time management in my life. Like in my regular life, I'm terrible with time management. I'm usually late, if not right on time, never early. So like having to not have that translate to my nursing practice, that would have been something that I really had to learn from the beginning. Unfortunately, I did not. So after the 6 weeks, I was pre-assigned to each floor for 2 weeks with a float pool preceptor. Now, this float pool preceptor, she is an amazing nurse. She's so kind, she's so smart. She loves to teach. She actually is getting her master's for nursing education, and she's gonna be great. She's the type of nurse that like doesn't stop. She's older, and you would never even, like, talking to her and like how she moves, you wouldn't even realize it. She cares so much about the patients, and then she cares about getting stuff done. So now floating to every different floor, I had only had 2 patients, and that's nothing. 2 patients is nothing. So when I started floating, at first I went to the GYN oncology floor, and she was like, all right, you got 3 patients. I was like, you sure? Okay. I'm doing the 3 patients. Then she was like, okay, you got 4 patients. And I was like, you sure? Okay. Let me do these 4 patients. Y'all, she was helping other people out because, you know, it's 2 nurses on, but only 1 assignment. So she was just helping hands. She's really like that. She just loves to help too. So she was helping other people while I was getting my morning stuff done. Y'all, it was noon, and she checked my patients. She said, Imani, it's noon and you haven't finished your morning med pass. And at that moment I like was bawling, because I really felt like I didn't know what I was doing, and I was getting close to being on my own, and I was like failing. And I feel like every new nurse gets to that point where they feel like, I don't know what I'm doing. But the amazing thing is that like somehow, some way, at some point, it is not always before you get off orientation for everybody, especially depending on the system and the way that you become a new nurse. Like if you go through a residency, it might be a little bit easier, or if you have good management or a good organization, good education department, it may be a little bit easier. Good preceptor, because your preceptor is everything when you're a new grad. Some people, it happens after orientation, after you struggle, but everyone gets to that point where they're struggling and they feel like they're a terrible nurse and how am I gonna do this? I felt all of those things, and it was the first time I cried as a nurse. And I think I have been on orientation for like 2 months at this point, and I was like, I don't know if I can do this. I really don't know if I can do this. So she helped me to get caught up. Thankfully no one died or anything like that, but it was just funny. So after that, she realized like where my deficits were. It wasn't in like general knowledge. It was like I knew how to do a full head to toe assessment. That's basic. I knew how to hang meds. I knew how to give the meds. I knew how to chart. What my issue was, like I said, it was time management and what's that thing? Prioritization. So she stepped it back and really like helped me to break down my prioritization and my time management, who to see first, how much time to spend, what was important, focused assessments, depending on which floor I was on, look at my patient, look through the chart, ask good questions during report, how to think through the body, the physiology, the diagnosis of this person, what they might be here for, what needs to be done or should be done, what hadn't been done, looking at the orders and looking at the lab work, how to ask the doctor questions, how to advocate for the patient, like all of that. But to be honest, like she really helped me get to the point where I would feel like okay being on my own. But when I got to the point of orientation being over, my preceptor was like, you should be good, but you should ask for more time if you feel like you need more time. I asked for more time and my educator said no. Like I told y'all, she's a go-getter, and she said she felt like if I needed more time, then that meant that like there was something I really wasn't understanding about nursing, and that meant that I wasn't safe. Like, not that I just wasn't comfortable. She said you shouldn't feel comfortable coming off orientation. That's gonna take time. And she was completely right. It took me a good like 6 to 9 months to not feel like so panicked when I was going into work, and then at like a year mark to kind of feel like I was in a groove. There was one floor in particular I remember I hated going to, the renal floor. I struggled on the renal floor for a long time, but now the renal floor is like the easiest floor for me, because most people, once you get to a certain understanding of like the kidneys and people who are in kidney failure or are in need of dialysis, it gets very kind of routine. They're very sick people most of the time, and there's a lot of things that alter in their body based on them having this kidney failure, obviously. But like once you get into a routine and knowing like what to expect, what to see, it's been almost 3 years now. Med-Surg, I never loved it. I loved learning. I loved getting to the point where I was overcoming challenges and hurdles and understanding and seeing different issues and managing them, but I never loved Med-Surg. I liked having the freedom that float pool gave me. I loved being a float pool nurse. I loved the flexibility, and I was full-time for a year, and then I switched to PRN, and baby, PRN is the life. I will do a completely separate video going into PRN nursing and why, if you can't do travel nursing for whatever reason, maybe consider going PRN, because it is so much better. It is so freeing. It is just another life to live as a nurse. So if anyone needs that, like just a little bit of encouragement about going PRN, I am here to give that. I will just go ahead and end this off by saying, like, as a new grad, like right after graduation, if you are gung-ho set on one type of nursing, I know it is very controversial for people to say, like, do Med-Surg first, do Med-Surg first. Not to stay there, because of course some people love it. That's cool. That's completely cool. We need Med-Surg nurses at the bedside, because it's crazy, as this past year has shown us, like with the pandemic, we need Med-Surg nurses at the bedside. But even more, like, Med-Surg helps you to use everything that you learned in school and bring it all together to look at the whole body. You have more information. I'm just giving an alternative way of viewing your career trajectory and your experience as a nurse, because let's be honest, like, we're needed. We're really, really needed. So yeah, we're powerful, basically, is what I'm saying. We are the backbone of the hospital, is what I'm saying. So that is all I have to say right now about my new grad experience. I loved it. Loved it. I don't think I could have had a better experience. And I felt fully prepared to be a nurse. Granted, I already had work experience. Nursing is my second career, but it's still just completely different than anything I had ever done. So I was, of course, brand new. Coming up in another video, I will be talking about the difference after graduation between an associate's nurse and a bachelor's nurse, because I did an associate's program first and then I got my bachelor's the next year. School won't tell you, teachers won't tell you. It's like people who live the life will tell you. So I definitely want to let y'all know about that. Make sure that you like and comment and subscribe. It's not just for me to feel good about myself, but for me to know, okay, is this content actually helping somebody? Is it reaching somebody? Is it something that I should keep doing, or should I just go ahead and pause? Because we all know that YouTube is not for everybody, and that's fine. I'm doing this for the sake of just helping people, and if I need to go ahead and have a seat, shoot, I'll have a seat. But let me know what y'all are liking, what you don't like, and what you want to see more of. Wherever you are in your nursing journey, just know that you are meant to be here and be the change that you want to see in this world, okay? Talk to y'all later.